Want to know everything you need to know about the NHI in under 10 minutes? Stay tuned. Hi guys, welcome back to Pharmers. If you're new here, I'm Patricia, your trusted pharmapreneur, pharmacotherapy expert, and everything in between. And in this video today, I'm gonna kind of try and break down what the NHI is in under 10 minutes, okay? Get your timers out, let's go. So the first thing you need to know about the NHI is that it is a national health fund. This fund is a pool of money that will be drawn from multiple sources. The second point is that these sources will include taxes as well as earners' contributions and employee contributions or employer contributions. The third point you need to know about the NHI is that it is going to be used to purchase healthcare services from various sources, including public and private healthcare facilities. That means primary healthcare is the first and biggest portion of the whole chunk, and that's where the emphasis and the core of the NHI is going to be. Then you're going to have hospital services and specialties, and this is where, if you're a specialist or if you have specialist services, you can come and position yourself, hint, hint, wink, wink. And thirdly, emergency medical services. Again, if you are in this field and you have the skills, start positioning yourself ASAP. The next point I want to bring up to you is that the NHI is a project. It is a lengthy process spanning over a decade or two, and it will not happen overnight. The bill was passed the other Wednesday, but stop getting alarmed, guys. You're not going to walk outdoors and just go request any kind of service for free anywhere in the country. That's not how it works. It's rolled out in phases. And this brings me to my next point, number 5, is that these phases are piloted. If you have known any chronic medicine parcels being distributed and dispensed in multiple private facilities, a lot of independent pharmacies, healthcare centers, medical centers have already been enrolled and performing the primary and the first few phases of the NHI. So it's already happening, guys. I personally have set up over 100 pickup points in the Citibank district already 5 years ago, and have been monitoring and ironing out all the glitches and nitty-gritty so that facilities can get reimbursed. So guess what? People are getting reimbursed. It's already happening. Many public sector patients have been collecting their chronic medicines through pharmacies like Kalapeng, like Clicks, Dischem, a lot of the independents, and even other healthcare medical centers as well. So if you think it's a new idea, it's not. If you think it's politically inclined, it's not. I mean, if a project spans over 25 years, it's bound to encounter the 5-year cycle of elections at some point. Like, it's not specific to this election, guys. Just relax, okay? The next point I want to point out is the funding model, because, oh my gosh, this is easily the most contentious topic. If they can't really manage ESCOM, how are they going to manage this? And they can't fix their own facilities. How are they going to manage this? Guys, facts over feelings. Different entities, different establishments have different managerial styles. ESCOM is a Schedule II public entity that is run independently and that is profit inclined, okay? Totally different to the NHI, which is a Schedule III public entity that has not a for-profit agenda, and that is social and economically inclined. If you want to measure apples to apples, try measuring that to SARS. I don't think you have an issue with how SARS manages its money, do you? and or the CSIR, etc., etc. So very different apples to bananas here. Next, I wanted to mention that the NHI seeks to improve coverage. Because it's a national healthcare insurance fund, it seeks to cover more of the population because currently there's only about 19% that's on medical aid, and the rest just have to wing it. So more of the population will be covered. It also seeks to cover more services and more access to these services. Because obviously if 80 something percent of the population is stuck with 10 facilities, for example, then they all have to go and flock there. Whereas if there's a sharing between private and public, the public patients can then share the private facilities, which the government will purchase services and products from and then send them there. So instead of flocking to the 10 facilities that the government has, they can now distribute better and go to 10 private facilities and have 20 altogether, if that makes sense. And then the third kind of coverage that this NHI seeks to improve is upfront fees and costs, because you currently have to go in and pay up an initial amount for most things in places for healthcare, but with the NHI, the upfront fee will be done with. So people will not have to die. It's wild. But anyway, a lot of times it's because people can't get to help quick enough, and when they get there, they don't have money, and then they end up dying on like the benches and stuff. It's ridiculous. So if you're not poor or haven't been in some of these facilities to witness some of the trauma, then you won't understand why this is beneficial to the majority, because the majority is in dire poverty. Yes, there's other issues to deal with that and address poverty itself, but let us just recognize for 1 second that all of us who have medical aid and have disposable income to just go pay a specialist $10K if we need to, we are privileged. We are actually very privileged. Point number 7 or 6, I don't even know where I am now, is that this fund will be used to purchase services from other healthcare facilities. So if you're a healthcare professional, this is your opportunity to start a healthcare facility that will comply, that will be accredited and licensed by the board or the Office of Accreditation for these healthcare centers. Because government will come to you and request it, just like we did with CCMDD. We went knocking on all possible doors, asking if they were interested, asking if they qualified, ironing out compliance issues with SARS because a lot of people were not SARS compliant, fixing bank account details, name details. And once they were fine, they got enrolled and it started rolling easy and smooth. So if you have any services, any facility, ambulances, whatever, start positioning yourself now so that you can benefit from more more traffic and more requests from the NHI once that specific phase starts rolling out. Lastly, guys, as a bonus point, I just want to say no system is perfect, okay? There's not a country in the world where you will go and have perfect healthcare for all of the population. This is a long journey towards that. Yes, we know there's disparities, big gaps, etc., but that's why we got to start somewhere. We're not going to get to the destination if we never begin. So let this process begin as it has begun with CCMDD and now rolling into the law, and let it happen. It will have glitches, it will have problems, and those will be able to get ironed out. There's not a country in the world that hasn't had these issues, that hasn't developed and are still currently developing and progressing in their healthcare reforms. By the way, healthcare reforms and reforms in general in South Africa specifically have been running since 1928 or something. That's close to 100 years. So it's baby steps, guys, baby steps. Don't be fearful, be factual, and be ready. You have all the time. Take our readiness packages. Let me throw these in here. You can take the next 5 years to get your facility NHI ready. And if you need help, call on us and we'll help you. Your clinic as a primary healthcare professional or facility or pharmacy, if you're a pharmacist, your clinic is going to be the biggest thing to invest in and to develop. So I hope you understood the NHI. If you enjoyed this video, put a big thumbs up, comment below, let me know what you think about the NHI. If this video helped put your nerves at ease a little bit, if you actually have read the bill, because 90% of people who complain haven't read it at all, and what your recommendations would be. Let's continue the chat in the comments below. Subscribe if you're not yet. Welcome to all the newbies, and I'll see you in the next video. Bye. Oh, and if you have video suggestions for the future, do drop them in the comments below too, so that we can film those for you and continue providing the quality and the value, you know? Bye, guys.